All right, your procedure is finished. Now, let's go over how to take care of the area so you can heal properly. We'll start with the most important step right now, which is controlling any bleeding. For the next few hours, our main job is to help a good, stable blood clot form right where the tooth used to be. You can think of this clot as a natural protective cover for the area. It's absolutely essential for proper healing. So first, I need you to bite down firmly and consistently on the gauze pad we've placed for 1 solid hour. Now this next part is critical. Do not spit. Do not rinse your mouth. And do not use a straw. Any of these actions create suction in your mouth, and that can pull out the blood clot we need to stay in place. It's also perfectly normal to see a little bit of light oozing for the first day or two. So if you see some pinkish saliva, please don't be alarmed. That's just a normal part of the process. Okay, once the bleeding is under control, your next focus will be managing discomfort as the anesthetic starts to wear off. The trick here is to get ahead of the pain before it really starts. Here's the most important tip for that. Take your first dose of the prescribed pain medication before the numbness in your mouth completely disappears. This will make things much more comfortable. And please, under no circumstances should you take aspirin, as it can thin your blood and increase the risk of bleeding. What you eat and drink for the next couple of days is also very important for protecting the area. First, wait to eat anything until the numbness is completely gone. This is to prevent you from accidentally biting your cheek or tongue. When you are ready to eat, stick to soft, lukewarm foods. It is absolutely crucial to avoid anything hot. Hot food or drinks can dissolve that protective blood clot. Also, stay away from greeny foods like rice, which can get stuck in the socket. And finally, no smoking and no alcohol, as both will significantly delay your healing. You can expect to have some swelling. Again, this is a totally normal response from your body. Here are 2 simple things you can do to keep it under control. For the first 24 hours, apply a cold pack wrapped in a towel to the outside of your cheek over the surgery area. This will help reduce the inflammation. Then, when you go to sleep tonight, use an extra pillow to keep your head elevated. These 2 steps really do make a big difference. Now, I have a very important warning for you about your stitches. Please listen to this one carefully. I know it's tempting to want to see the area, but you must not pull on your cheek or lip to look at the extraction site. The area is swollen and tight, and that movement can easily cause your stitches to tear. Okay, let's talk about the last couple of steps for keeping the area clean as you move through the rest of the week. After a full 24 hours have passed, and as long as the bleeding has stopped, you can start to very gently use the medicated mouthwash we prescribed. You're not going to swish vigorously. Just gently tilt your head from side to side to let the liquid clean the area. Then, we'll see you back here in 1 week to take out the stitches and check on how you're healing. Of course, if you experience any severe pain that the medication isn't helping, or if you notice any heavy, continuous bleeding, please don't hesitate to call our office right away.
Geçmiş olsun.